Welcome to the Beverly Hills Plastic Surgery Podcast. Today, I am here with Dr. Millicent Rovelo, who is not a man, and we are going to be talking about male plastic surgery.
You're correct. I'm most definitely not a man.
Right.
And we are talking about male plastic surgery because it's like really having a moment right now. I mean,
is it ever?
Everyone is talking. Everybody keeps asking. We have listeners requesting us to talk about, Bradley Cooper and what has he had done and this and that.
And Jim Carrey.
And Jim Carrey. It's a moment that the
Brad
men
Pitt.
are having. Yes. Well, Brad Pitt's, people have been,
I mean, they always talk about Brad Pitt. How could you not?
Yeah. But like those are the two kind of most recent ones. And I think it's a good segue into male plastic surgery, in particular of the face, and how it's different than what you could expect in a female, and what constitutes a good outcome for a male facial plastic surgery, because it's different than what you would expect from a female.
I can jump in right here and just say the take-home message is you don't want to make men look like women. In this case. There are other times that we want to do that, and we do that a lot. But in this case,
right,
when it's a man who says, I want to look better, I want to look like myself and look great, the key is to not do the female versions of these operations on the male face. And I think that's where we have a lot of problems in terms of how people get. I can name people throughout the ages of men who've had bad plastic surgery because we can see it. The guys who have good plastic surgery,
you don't know.
You don't see it.
Right.
They just keep looking great.
Right. Yeah. So let's start with those two that we kind of just referenced, and kind of break them down, and then go into what you can expect if you have plastic surgery and you're a man. So Bradley Cooper, and that I got all those same kind of things you did. Like, what happened to Bradley Cooper? Right.
Like, what's going on with his eyes? What's this? What's that? Did he have a facelift? Did he do that? Looking at those before and after photos, it looks like he had his eyes done. And there was another celebrity who had like an eye job that just was so just blaringly like different. It's I don't know whether it's good or bad, quite honestly, but in my estimation, it's not a good eye job because it took away some of his masculine features. It didn't make him better looking. It made him look different.
Well,
and that's what I don't like.
Define what an eye job is. That's not actually how we talk about it as plastic surgeons. It's a very odd term to hear you say that. I'm like, eye job?
It's an eye job.
Weird, awkward terminology.
Blepharoplasty. Well, people don't know what a bleph is. So when we say blepharoplasty.
Eyelid surgery, eye job.
It's an eye job.
It sounds almost dirty somehow. Let's just call it like eyelid surgery.
I don't even know what that would look like.
I don't know either. But it's something to think
there you
about.
go. You got it there. All right. So we'll take it. But he had a blepharoplasty. It looks, we don't know what he had. Maybe, he has something new that we haven't even thought
What's
of.
a blepharoplasty?
Blepharoplasty is when we make incisions in the eyelids, upper or lower, and we typically remove some fat, remove some skin, try to rejuvenate it, make the eyelids look refreshed and better. But
because what happens with time and over aging is that you get extra skin of the upper eyelids. It starts to droop and hang over your upper lids. It makes the eyes look smaller. And then you can also get bulging of the fat that lives around the eyes, which can make them also look kind of puffy. So when we do these in women, we make that incision in the upper eyelid crease. We take out little pinches of skin. We take out some fat so that the eyes can be open and look really pretty and youthful and rejuvenated. And that's a classic upper eyelid blepharoplasty.
Very different than in a man, because in a man, you want to preserve some of the lateral fold. You want to keep some of that volume.
The lateral fold is like the extra skin on the outside.
Yeah, right. Out towards the corner of the eye, out towards the...
By your ears.
By the ears, yeah, as opposed to towards your nose. But, I remember like Bob Costas, who's a big sportscaster, got blepharoplasty, and they took all the fat out and all the skin.
Which they used to do like back in the day.
And it doesn't look good on a guy, that's for sure. And I don't think it looks good on women either.
Women either. We don't do that anymore.
And you saw like skin over the globe. It looked really, it looks cadaveric.
Right.
It looks like they're dead.
Yeah,
it doesn't look good.
Not a good look.
And I remember when that happened. And by the way, you can do something about that. You can fat graft it. There are ways to make it look better. But the way to not have to deal with it is to avoid it in the first place, right? You want to make sure that you get really, keep the fullness. So anyway, Bradley Cooper, the thing was I think they just took a lot of the fat out, and it just looks hollowed out, and it makes his eyes sort of look, kind of like
very prominent.
odd. Yeah, just
Yeah.
very
He's-
different than before.
Right. Because he always had sort of the slanted eyes, that little bit of hooding, like you talked about on the outside. And now they're just very round and they're just and they are so blue. He has these very blue eyes. So it's the first thing you see when you look at him are these like really prominent eyes.
Yeah, I mean,
And I don't
Still
know if
looks
he's
good.
had other plastic surgery. My gut says I don't think so. I don't get a whole lot of great like side views that when I look up his photos. But just looking at him front on, I don't see evidence that he's had other stuff done. To me, it just looks like the eyes.
yeah, and maybe it's photoshopped also, which
Yeah, so you never really know. But from the photos that at least that we're getting.
Yeah, exactly. I mean, like you look at like the Kris Jenner stuff now, they're like, oh, this is what she actually looks like. Those
Right.
are all photoshopped to the nines. Wow, really?
Shocking.
Is that
Wait, really?
I can't even believe it.
Facelifts don't completely blur every single line and crevice on your face? What?
Whatever. Everybody's got to like, you got to just take it with a grain of salt, people. That's the way that it is.
Yeah.
You got to understand Hollywood has its way.
Yes.
And they've got their idea of, there's what's so and how they want to present it. They're two different things.
Yes.
And then you commented in Radar Online. Yeah, so there's a you can look up Dr. Rovelo's comment on the internet about Jim Carrey's facial work, whatever. And what did you think? What was the take home?
Yeah, so he was at a show recently. He was presenting, and people were commenting on how he just looked different, maybe a little bit strange, and there, what has he done? And it's actually a very similar thing to Bradley Cooper. And my comments were basically that it looks like he's had his upper eyelids done. Because if you go back and look at his photos from a year ago, he actually had really severe excess skin of his upper eyelids, severe hooding. It's like, I don't even know how he could see out of the corners
Right,
of
so
his
he
eyes.
needed it done.
He kind of needed it done. And I reference that as like, this is often done as a medical procedure because when the extra skin really starts to hang over the corners of your eyelids, you actually can't see out of the sides of your eyes. And it's hard when you're driving. It's hard when you're trying to do anything that requires that more peripheral vision. So he kind of needed it. But it is a bit of a drastic change because he went from being really hooded to now having a really open eye. You can really see how round it is. But I don't think he had any other plastic surgery done. But when he's talking in these videos and he's presenting, his face does move in a little bit of an odd way, which to me looks like his lower face moves and is very expressive, but his eyebrows and his forehead don't move. They're very frozen. So it just looks a little like disjointed. Like I Botox all of my face, so none of it moves.
Well,
So, if you're going to do a little bit, you got to do it all or just do a little bit.
I wonder how old he is now. He's got to be 67, 68 years old,
Yeah.
somewhere in there. So that's about the time you got to do this stuff. It's time.
It makes sense. And then it's not fair when people on the internet say, look at him in 2025 and then look how he looked in 2000. And they compare these side by side. And it's like, well, it's
25 years,
25 years ago.
Hello.
And regardless of whether or not he had any plastic surgery or whether he had Botox, the face ages. It's going to look different. It gets heavier. It gets fuller. And I was like, oh, he's had fat grafting or he's had filler. No, he has just gotten older and his face has aged and gotten puffier as it does. So there's a lot of that you have to take into consideration. You can't compare your photos from 25 years ago and the ones now and be like, well, what did he have done to look different? Like
he got
age.
Yeah, it definitely is part of the deal.
Yeah.
So, you just have to kind of understand, like, we're all going to need to do that sort of thing, especially with the eyelids and the skin. If it is hanging over your eyelashes and obscuring your vision, then it's a really good thing to get these operations done for medical reasons.
In fact, insurance, Medicare will cover it if you can prove that it's medically and medically necessary and impeding your vision. But I think that both of these incidences are good segues into talking about male plastic surgery and why it needs to be different than female plastic surgery of the face.
Yeah, you have to really tone it down. So I get a lot
underdo it.
I get a lot of executives. So my male plastic surgery patients are from Silicon Valley. They're lawyers. They're people that are in their interest is to keep working their jobs, but they want to look like refreshed, like they're still youthful, vibrant, and in the game. Because when they start looking like the old man And that was one of my patients who came from Silicon Valley, kind of said, like, he was in a meeting with his whole board and 20-somethings and 30-somethings that run these tech companies. And he was in his 50s, and he said, well, let's see what the old man wants to do. And then he was looking around, and he was like, yeah, let's do that. And then they kind of went, wait, am I the old man? And he was like, I'm the old man. That's who they're talking. They're talking about me. And he was like, I need a facelift. So then he came down from up north and got his facelift, and still in the game. And he looks great. And that was probably 10 years ago. And that's what they should last. For men, if you do a good job, like they always want it a little tighter, but I'd rather them tell me it's a little like, oh, you could have made it tighter than making them look weird.
Yeah, because if you pull it as tight as they want it, they're going to look weird.
They look like a bug.
Strange.
They look strange. Yeah. I had a friend who I did his facelift, and he looked great. He looked awesome. It was like a vibrant, he was like 70, and I did it, and he looked like a vibrant 50-year-old guy, looked amazing. He's just like, I really want this tighter. I really want this tighter. I was like, I'm not doing it. You look great. So then, like, he was like so angry with me that I wouldn't take him back and make it tighter. And like 2 years later, one of my other docs was like, hey, I saw so-and-so. And they go, you didn't do that to him, did you? I was like, do what? He's like, he looks freaky. I was like, no, I didn't do that.
Good thing you didn't.
No, he's like, I go, he really wanted me to tighten up. He goes, I refused. I'm sure he went somewhere else. He goes, oh yeah. He goes, you don't do that. And I saw him, and I was like, oh my God. And so like some people want that.
Some people like that look.
They like it.
And if you're okay with everybody knowing you've had plastic surgery, that's totally fine.
And scaring people, like children.
That's not scary. It's the small children.
It's scary. They look weird. Don't you think?
Yeah, it's a choice. It's a choice.
It's like,
but if you're trying to go through life, gracefully with as little bit of attention as possible, focused on what you have had or haven't done, and if you don't want to have any, celebrity gossip magazines talking about what you've had done, the trick is to, yes, underdo it.
Well, the way to not have celebrity gossip magazines talking about you is don't be a celebrity.
Well, that too. That also helps.
So we're covered. I do want to mention the Kevin Nealon character from Just Go With It, if you remember, when Adam Sandler and Nick Swartzen walk up to him, and Swartzen goes, I didn't know this was a Halloween party. He's like, are you serious right now?
We don't want to make people look like that.
No, you don't want to look like that. Yeah, that was a very, very funny character, because those people do exist. They do. They just they look odd, and their face doesn't move right, and that's totally overdone. That's not good male plastic surgery.
Yeah, the other thing you have to be really careful about with the men are the brows, the eyebrows. So frequently when we are doing female facial rejuvenation, part of it includes elevating the brows and getting them into a little bit of a higher position. And that, again, opens the eyes. It makes them look very youthful and refreshed. If you do that same move on a man and you elevate the outer aspects of the eyebrows, they look weird. That's when people start making, comments like they look like Mickey Rourke. They have this unnatural brow position, which looks very odd on a man of a certain age.
Oh, yeah.
And so it's so obvious that they've had something done, and it doesn't match the rest of them. Women, we have soft skin, and we have hair, and we wear makeup, and we're pretty, right? Like, men have facial hair, and, sorry, but you guys gonna smell, and you sweat. Like, you're not supposed to look like swept back and beautiful.
On behalf of all men, I take offense to the smelly comment. We do.
But am I wrong?
No, we do. I have teenage boys. They're smelly. That's the way it is.
Men just present differently. And that kind of pretty upswept, eyelid appearance is discongruous with the rest of their appearance.
Now, that was like Kenny Rogers back in the day. Like, everyone talked about Kenny Rogers because he had this crazy brow lift, and his eyebrows were in the middle of his forehead. That's not normal.
That's not what they're supposed to be.
They should be on the on the ridge. If with men, it's even okay that they're a little bit lower. It's all right.
Yeah, the ridge is above, that bone that runs around the eyes, the orbit. So classically, in women, you want the brows to sit just a little bit above that upper brow bone. In men, right at or even just a little bit below is acceptable too. But yeah, when they're way up here on anybody, that looks a little strange, but especially in men.
That's the mantis lift I talk about. I don't like it. I don't like the mantis look. I also don't like that they eat their mates after they procreate.
I mean, sometimes it's warranted. Sorry, I'm bagging on you today. I'm sorry.
I know. I should have gotten into the Everlast punching bag suit and just taken the hits. Well, but I like doing male plastic surgery because I think the men that do come to me look great, and when they're done, they do send their friends, and that's kind of where my patients come from. Is it's referrals from other people who've had surgery. All this Instagram and TikTok and stuff like that. Once in a while, somebody comes from that, but mostly my practice is referral based,
right.
and it's a lot of doctors and lawyers and professionals and people around town that work in the business and the industry. So like they need to look normal. They don't come to me to look extreme.
Right.
There are people that do that. There are people in my building that do that. My friends do that. Good for them. That's not my game. I know it's not your game. You've done a bunch of male facelifts since you've been in the office, and they all look really nice. They just look very normal and refreshed and good, and you have happy patients. So, but you can get, there's a spectrum of what you can do for male plastic surgery. In fact, I did a mid facelift on a guy from Midwest, and it's funny because he came in. He's like, "You see how my eyes go down? You see how my brow goes down? See how this goes down?" I go, "Yeah." He goes, "This is what I want." And he put 3 fingers into his face and literally was able to kind of contort it and put it right where he wanted it. I was like, I can do that.
I can do that for you.
I was like, I got it. I got that operation. He was like, "Really?" I was like, "I really got it." But he knew exactly what he wanted. And
that's funny.
It was so funny. I was like, "You got to do that again. I'm getting that on video." And he could nail it. He got the canthus up. He was able to put the brow where he wanted, take the cheek up.
The cheeks up.
Kind of right on.
He needs the 3-finger lift.
That's what it is. But I've had patients like that where when the canthus is down, when they're
the corner of the eyes.
The corner of the eye is canted this way, where it goes. It's higher medially and lower laterally. People don't like that. It makes them look sad. And one of my patients told me she used to Scotch tape her canthus up when she was a kid because it was that way her whole life. Yeah. And finally did a canthoplasty and elevated it, which is probably a topic we need to cover in and of itself because a lot of people are asking about, canthus work and the fox eye procedure. Yeah. But, it's out there. Men typically don't need that unless they really are lower, and then you do want to get them to be at least even.
Right.
It's a good operation. It works.
Yeah.
What else about men?
I think
fat grafting you have to be careful.
Oh, you gotta be careful.
Gotta be careful with fat grafting.
Judiciously, it's great. And it is, if you do a nano fat grafting, it can help with skin quality and texture. But yeah, you really don't want to make men look puffy. That is not a good look. Do not do lip lifts on men. That is. It's a little weird. I mean, you can have very long lips in men, and that's okay. When you start trying to make them look a little feminine, it's not cute.
What about lip filler?
Oh, please don't do lip filler. There's nothing worse than seeing that. No lip filler.
I don't like that.
No lip lifts.
I do not like that with a goat. I do not like that in a boat.
What else is not? Neck lifts, facelifts, yes, all great.
All day long.
All day long. Some lasers to resurface the skin, get rid of sunspots. Light use of Botox, I think, is great just to help kind of soften some fine lines. But yeah, in general, less is more with the men. Big time.
Big time.
Yes.
I think that kind of wraps it up. I think we got through the big take-home message, which is underdo it, if anything. But you have to make it tight enough. There's a balance, and that's what you're looking for, is that aesthetic balance that just enhances the looks without making them look strange.
Right.
Well then, this is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.